In this video, we will debunk 8 myths about healthcare access for non-qualified immigrants in the state of Texas. Who is not a qualified immigrant? If you're undocumented or have a type of legal status such as DACA or TPS, you are not considered qualified. If you're a qualified immigrant, watch video 1. True or false? If I'm a non-qualified immigrant, I'm eligible for Medicaid benefits. False. In Texas, non-qualified immigrants are not eligible for full-scope Medicaid. True or false? If I'm a non-qualified immigrant, I'm eligible for emergency Medicaid benefits. True. All immigrants are eligible for emergency Medicaid regardless of their immigration status. A qualifying medical emergency requires the onset of an emergency medical condition and acute symptoms that are severe. A qualifying medical emergency may include things such as labor and delivery, but typically excludes things such as outpatient dialysis and organ transplants. Always seek medical treatment in an emergency. ER departments cannot turn you away due to immigration status or inability to pay. True or false? If I'm a non-qualified immigrant, I'm eligible for CHIP benefits. False. If you're a non-qualified immigrant minor, you are not eligible for CHIP benefits. True or false? If I'm a non-qualified immigrant, I'm eligible for the CHIP perinatal program. True. In Texas, pregnant people are eligible for care through the perinatal program regardless of their immigration status. This includes prenatal, delivery, and postpartum care. True or false? Emergency Medicaid is the only way for me to get health assistance. False. Non-qualified immigrants can get health assistance through FQHCs and safety net hospitals regardless of your immigration status. Safety net hospitals provide care to low-income, uninsured, and vulnerable populations. Publicly owned ones are providing free care. Meanwhile, nonprofit-owned safety net hospitals require some sort of payment, and for-profit-owned safety net hospitals are the most financially stringent. No matter which hospital you get treated at, ask to speak with a patient advocate. They will help communicate with your healthcare provider so you can get the information you need to make decisions about your healthcare. They can also help you set up appointments for doctor's visits and medical tests, as well as get financial, legal, and social support. Meanwhile, FQHCs are medical centers that offer services such as dental, mental health, or substance disorder treatment. These sites cannot deny services due to an inability to pay, and patients may be eligible for discounted services on a sliding fee scale based on their family size and income. FQHCs in Houston include Montrose Center Clinic and El Centro Corazon Eastwood. True or false? I have to reveal my immigration status to my healthcare provider. False. Hospital emergency rooms, FQHCs, and public safety net hospitals must treat you regardless of your citizenship, insurance, or money. If someone asks for your insurance, you can simply say, I am not eligible for health insurance right now and do not want to apply. Additionally, healthcare providers have no requirement to inquire into or report to federal immigration authorities about your immigration status. In fact, HIPAA privacy rule generally prohibits the use or disclosure of patient information without your consent except when required by law. True or false? Immigration enforcement actions can take place at hospitals and other healthcare facilities. False. Hospitals and other healthcare facilities are considered by ICE and CBP to be sensitive locations. This means that immigration enforcement actions should be avoided at these locations unless exigent circumstances exist or the officers conducting the actions have prior approval from certain officials within these enforcement agencies. Should immigration agents try to enter a public area of a healthcare facility without a warrant or consent and try to question any person present, these people have the right to remain silent and request an attorney should they be questioned. Healthcare providers may also refuse to consent to warrantless search of private areas of the facility. True or false? I can have an interpreter assist me while seeking healthcare or applying for insurance. True. When seeking hospital or emergency room care, you have the right to a free interpreter. This includes bilingual staff, telephone interpreters, or in-person interpreters. When you apply for a Medicaid or CHIP plan, you can also request a free interpreter.